Welcome to our video about bad breath, what causes it, and how to get rid of it. One of the most important things to do in order to treat halitosis is to determine the cause of your bad breath. Foods and beverages can affect the quality of your breath and oral health. Because food enters your bloodstream, it can affect your breath as well. Foods that are left to rot in your mouth also contribute to a bad smell. To make your breath smell fresher, try cutting down on these things or replace them with a higher protein diet. Tobacco. Tobacco causes bad breath directly and indirectly. When you smoke, the tar and other substances released during the combustion process enter your bloodstream through the oral mucosa and lung alveoli. These substances then accumulate on your teeth, causing your breath to smell foul. The amount of odor on your breath varies based on the tobacco used. Cigar and pipe tobacco smokers tend to suffer from more bad breath than non-smokers. Smoking also contributes to gum disease. Tobacco contains chemicals that make gum tissue brittle and can inhibit the normal function of the cells in the mouth. It can also contribute to mouth wounds, causing you to develop bad breath. Furthermore, tobacco causes dry mouth, which can contribute to halitosis. Luckily, saliva acts as a natural mouthwash, so drinking water can help to rinse away cigarette smoke. The best way to combat tobacco breath is to stop smoking and chewing tobacco. In addition, flossing your teeth will help to minimize the odor you produce from cigarette smoke. And don't forget to get regular dental checkups. Getting your teeth cleaned by a dentist will reduce tartar and plaque, which can give tobacco particles a stronger grip on your teeth. Additionally, you'll minimize the chances of developing yellow teeth from smoking. By following these tips, you'll be well on your way to fresher breath. Besides tobacco, other oral health problems caused by tobacco use are also a problem. Cigarette smoke, for example, leaves behind chemical compounds that mix with saliva and cause a foul odor. Also, tobacco use causes poor oral hygiene, as poor dental care results in food particles in the mouth and plaque-filled pockets between the teeth. The tongue can also trap bacteria that cause odors. In addition to causing bad breath, cigarette smoke can also cause gum disease. Alcohol. If you drink alcohol, you probably have noticed that it tends to leave you with an unpleasant aftertaste. The alcohol itself tends to dry out the mouth, causing it to produce less saliva. Your mouth is what controls your breath, and the alcohol kills both good and bad bacteria. Unlike the good bacteria, the bad ones replenish their losses faster. That is why avoiding alcohol is essential. But how can you minimize the effects of alcohol on your breath? There is no simple answer to the question, how does alcohol cause bad breath? Drinking alcohol can lead to a variety of side effects, including esophageal issues and mouth cancer. The bacteria that cause bad breath are produced by the digestive system as a result of dehydration. Additionally, the alcohol can make your mouth dry, allowing it to produce more bacteria. The result is an unpleasant odor in your mouth. In addition to its smelly effects, alcohol also damages the esophagus, which in turn can lead to heartburn and acid reflux. If your breath is often foul, you should consider seeking treatment for your alcohol problem. If you are looking to improve your oral health, try a sober lifestyle and avoid alcohol. Achieving sobriety is the first step toward a healthier life. If you're an alcoholic, there are treatment programs that can help you get back on track. The only way to eliminate the smell from alcohol-induced breath is to stay away from alcohol completely. It's not worth it to try any internet miracle remedies that claim to solve your problem. Instead, stick to drinking low-alcoholic beverages or alternate between non-alcoholic beverages. These will mask the odor until your body can eliminate it. If this solution doesn't work, consult with an addiction specialist. You may also want to consider using mouthwash. Sugar. Many different factors contribute to halitosis, which is the smelly odor that accompanies a bad breath. For example, poor oral hygiene can contribute to bad breath by allowing food particles to settle in the mouth. Tobacco use, which dehydrates the mouth, also contributes to bad breath. Moreover, sweets and sugary foods settle in the teeth's grooves and feed the bacteria that cause bad breath. Those suffering from bad breath may want to try changing their eating habits. Sugary foods contain acids that can cause the smell to appear. If you're trying to stop bad breath, try eating less sugary foods or switching to a low-carb diet. This will not only give you fresh breath, but it will also help prevent other problems related to the mouth, such as periodontal disease. Changing your diet will make a difference, because it will reduce the bacteria that cause bad breath. Diets that include low-carb diets can also help reduce ketones in the blood. While this diet is not for everyone, it can be beneficial in certain circumstances, like improving glycemic control. When the body switches from burning carbohydrates to fat, it produces an acid called ketones, which results in a bad breath. Ketones are produced in the liver when the body needs energy, and they will linger on the breath until they are flushed out of the body. The culprits of bad breath are often difficult to pinpoint, but certain foods are known to be more prominent culprits than others. For example, a high-protein diet tends to cause the bacteria in the mouth to produce sulfurous gases. A low-protein diet can help you avoid the sulfur-causing foods and eat a balanced diet rich in fruits and vegetables. But sugary diets can also feed bacteria that live on sugar. High-protein diets. If you're on a high-protein diet, you're probably already aware of the associated problems with smelly breath. High-protein diets eliminate carbohydrates from the diet, forcing your body to burn more fat in order to meet your daily protein needs. While eating too much protein can lead to bad breath, there are several ways to manage your intake. Using a mouth freshener or mint candy can help, but it may not be enough. Another problem associated with high-protein diets is bad breath. A high-protein diet sets off a chain reaction when the protein is broken down in the stomach. Unfortunately, these excess proteins are not digested properly and the resulting amino acids combine with the bacteria in the mouth. These bacteria then produce a foul smell, or sulfur, in the mouth. So, avoiding this type of diet is crucial to avoid unpleasant side effects. Another way to prevent bad breath is to cut back on the amount of carbohydrates you eat. Despite the benefits of a high-protein diet, too much protein can lead to chronic halitosis, or foul breath. High-protein diets also cause the body to break down more fats than carbohydrates. This makes the mouth smell bad, so limiting your protein intake will reduce the likelihood of bad breath. Cutting down on carbohydrates can reduce the bacterial count that causes bad breath. Many people have trouble getting rid of halitosis, and cutting out sugar can help. Eating more fruits and vegetables may be a solution for bad breath. According to Dr. Harold Katz, a dentist and bacteriologist who founded the Breath Company, fruits and vegetables contain high levels of sulfur. These compounds are responsible for the foul smell. Dental problems. Halitosis, or bad breath, can be embarrassing and cause low self-esteem. Curing this condition requires treatment of underlying health issues. Your dentist and primary care physician can work together to determine the underlying cause of your bad breath and recommend a treatment plan. Otolaryngologists specialize in head and neck surgery, including oral cancer, facial plastic surgery, and lateral skull base disorders. In some cases, a dentist can also prescribe antibiotics for a short-term cure. Certain foods and medications can also cause bad breath. You should write down what you eat and drink before going to the dentist. You should also bring a list of the medications you take because certain medications can cause mouth odors. Your dentist will use this information to determine the best treatment plan. If none of these treatments are effective, a dental professional can perform an oral exam to rule out any underlying health problems. You should see your dentist every 6 months to ensure your oral health. Regular checkups can prevent cavities, bacterial infections, and gum disease from causing bad breath. Professional cleanings will remove trapped food particles, bacteria, and calcified deposits that cause bad breath. Proper oral hygiene habits can also keep the mouth clean and fresh. Having your teeth cleaned by a dentist can help maintain overall health and prevent future problems from developing. If you have persistent bad breath despite making changes to your diet, you should visit a dentist. Most likely, it's due to a dental condition. Changing your diet will not fix the problem. The dentist will need to rule out any potentially dangerous dental conditions. Your doctor can work with other health professionals to find the root cause of the odor and prescribe a treatment. If you have a toothache or any other symptoms that seem unrelated to your dental condition, a dentist will be able to prescribe a proper medication. Till next time. Have a great day.